Thank you. Thank you very much for inviting me here. After just seeing those last two presentations and know the one that's coming and all, and seeing all the ones that I was up against, it is amazing. It's truly amazing to be here, and I thank you very much. Tough cases. I've heard this idea of, you kind of go out on a limb to get something in place, or take a little bit of a risk to see if we can get this done, and you kind of cover your ground, and this is how these cases come about. A little bit about me. I'm a grandfather. I got two little grandkids there with me and my wife. My daughter up in the corner there, she was one of my Invisalign patients. I do like to race cars, so that's where maybe some of the daring comes from. I'm an illustration artist and have done some artwork in the past in some dental books and magazines. But that's sort of where the arts and crafts comes in for me. I'm from San Antonio. Thank you. Land of the home of the Alamo and the home of the Spurs. I wished I'd been able to give you a better report on the Spurs. They did good. They got to the finals, like us four. There's the River Walk. It's famous for, San Antonio is famous for. Hemisphere Plaza and the big boots. The big boots always go with Texas. This is my office. We're Cosmetic Dental Associates. There's about 35 of us. I have about 50-50 admin staff and tech staff, and together we pull together and create Invisalign and cosmetic dentistry and veneers and get to have fun just creating smiles in general. So our branded name is 33 Smile. You can find us on the web, 33smile.com, or dial us, 33Smile. The thing that attracts a lot of patients for us is having a cosmetic dental lab. We get to do the veneers and crowns and stuff like that oftentimes goes along with fixing things up that the Invisalign kind of can set us up for. So it's like a perfect marriage of cosmetic dentistry there, having an invisible movement of the teeth and then all of a sudden get to put those veneers on there. You can really come off with some fun finishes. This is the case that I got that you all voted on. Give me some more data on this. I've been doing Invisalign for, I guess, about 10 years. When Invisalign first started for GPs, because, again, wasn't allowed to do that. Only the orthodontist could at first. But we got started, and before that I had done a lot of straight wire and functional appliances. And I'd seen class 3s, and I'd fixed a few, and I had fun with it, and it was neat and all that. And when this guy came in, I was talking to him, I was feeling really pretty much like, okay, I got this handled. And then he sat down in the chair, and we're visiting a little bit, and then I kind of rolled the chair back and had him bite down, and this is what I saw, and I went, oh my gosh. It was fun. And I had to keep a straight face so that we could kind of figure out what we were going to do here. One of the things I noticed about the case is that it has attachments on it already. So I go, oh my gosh, so you've done Invisalign, or somebody was doing Invisalign with you. And yes, indeed he had. He'd been a year and a half in Invisalign, and this is where he was at, and I'm supposed to finish it now. So I thought, okay, I'm going to have to come up with a different plan than what the other guy had. And so there was a good plan that came up. It was quite remarkable. You can see on a couple of these incisors here, the teeth got ledged trying to do some IPR on it to shove them in and stuff like that. So this is a bad case. It got messed up. And so now I had to figure out how to bail this thing out, and so the wheels were really spinning on what I was going to do to make this thing happen. Well, the first thing I did was kind of like look at the arches, and I could see that the canines, they looked to me like they were pretty close to the right spot, and that the 4 incisors needed to come forward and just line right up with them, and then I'd have a nice huge arch to stick all these teeth in. In fact, it looked like it'd give me a whole tooth jump there. which is what I needed. The lower set, if I kind of snazzed up the damaged teeth, they would be kind of slender, and then I could tuck all the teeth together and snug them all up, and that'd give me maybe another millimeter or so, and then I'd have my class 3 jump. So it looked like it was going to do. Okay. Another thing I did, which is not available in this picture because I can't get the picture of it, was look down inside the lingual of those lower incisors to see what those upper incisors were doing to it, and they were okay. This is the smile that he walked in the office with and kind of started talking to me about it. And so while I was talking to him, this is when I got the idea that, yeah, this guy, he's class 3. That lower jaw's out too far. And then he bit down, and this is the ceph of what I got. The lower incisor was indeed completely up in front of the upper incisor. And I had never seen that before. I mean, I had had some that I would describe to my friends as, oh yeah, the lower teeth covered the upper teeth, and it never really quite did, but this one finally did it. So I guess that's why he walked in my door. But the upper incisors, they're all lined up even with the canine, so you just have a mass of incisors there in the front tucked into those lower front ones. So this is the case. It was a one-phase treatment for our office, if you don't count the first phase that he went through in the other office. I wasn't going to count that. It took me 33 aligners, 20 lower aligners, and 17 months. We did not have a refinement with this case. That was kind of neat because something happened during the case that I think made it possible not to have to do the refinement because of the way I was having him wear it. Now I'm going to get into that in just a minute. Class 3, anterior crossbite, yeah, sure enough. Now here's the clin check. We're planning this up, trying to figure this thing out and come up with how this was really going to happen. And of course, when that happened, it was like, hey, that looks good. Is it going to do it now? That's the trick. Because the guy came in already, I'm sure his first clin check in the other office looked just like this too. Not dramatically different than this. But something happened that didn't let that thing work. It was, he came in, I think he was about midway through the aligners, maybe 2/3 of the way through the aligners, and he was presenting with a completely, well, the class 3 that he walked in with. And the aligners, I noticed, they didn't fit at all, and the teeth were all, not even anywhere close to representing what the aligner had. They were not translating at all. Now here's the before and after. When we, you can kind of see here a little bit. This is kind of fun because I actually have a ceph here that really shows something. The ceph on the left is the before, where you can see the palate is like got a 90-degree angle in it. It's kind of hanging down, tucked into the lower incisors. And the lower incisors are up in the air there. Now, if you go to the next ceph, you can see the palate is definitely curved open now. You just follow that bone right out. And there's where those incisors are sitting. And the lower incisors are now down and up and inside the bite. So we had some very realistic skeletal changes here. I don't think we had any, like resorption and rebuilding of bone and all this stuff. We bent the premaxilla back out where it belongs. So the idea of movements like this, I think we can start to look too at not only is there resorption, but in addition to it, we're actually bending or folding or unfolding the alveolar process. So this is where we finished off. He was pretty happy because he looked real different now, profile and all. The teeth came out particularly good on his left, and the right is still open a little bit. And that's just a matter of time. As restorative dentists, we all know about super eruption and everything like that. This is coming. We do follow up with them, and it's getting tighter and tighter. So I'm not too worried about that. And here we go. Here are the two arches you get to look at from above. There's the 4 incisors. They came right out. lined right up with the canines like we were hoping they would. And then the lowers, they're all smoothed up now and tucked right in, and there was the extra room that I needed to get this thing done. And there's his smile now. He gets to actually smile and not have lower front teeth show. He gets to eat right side up.
I approached Invisalign with caution and skepticism due to my severely overcrowded and crooked teeth. I thought traditional braces were my only option. When I had my consultation with Dr. Moore and his staff, I knew his knowledge with Invisalign and his success stories convinced me he could help my situation. The process was simple and painless. After a few months, I was amazed at the progress. After the treatment was over, I had a perfect smile, and I was completely overwhelmed with its success. I'm a true believer in Dr. Moore's abilities and with the Invisalign process.
Okay, so that was really nice. The point, or the part that where he's talking about being convinced that this was going to happen almost sounds like I was trying to convince him to do this thing. And frankly, what I was really trying to do was convince myself and hedge my bets and kind of communicate the idea we're going out on a limb here. There are not going to be any guarantees with this thing. But I think when we talked about, and this is something that I think really is helpful, is that if you talk to the patient and you get from them what was going on before or what's going on with them, you can figure out what went wrong and how to get around the thing and get it fixed. So what I got from this was this description of what was going on with him while he was trying to eat, because the real key to this case was not going to be whether we could come up with some Invisaligners that looked like it would jump the bite, but it was how are we going to get him to really jump this bite, because that jump was going to be the problem. He's got his lower front teeth completely in front of the uppers, and we got to get him out clear over here, and somewhere between here and here, he's going to have to learn to eat. So as it goes, it gets closer and closer to the lower incisors. He takes the aligners off and starts to eat. So now he's like banging into the backs of the lowers and shoving back on the uppers where we were trying to push them forward. And of course, this is just like tug of war. We're having a mess go on. And then once we finally get it almost to where it's end to end and he's trying to eat, he's glancing off the edges and skidding out and scraping teeth and just having a dickens of a time. And in his head, when this is going on and he's trying to eat, it seems like, oh my gosh, this is horrible. I don't know about this Invisalign. It doesn't seem to be working. This is like I'm having a bad time with this. And you can imagine that he was. So our way around this became, okay, so when this happens, and this is the part that came up in the first consultation, it was, okay, so this is going on. We're not going to do it that way. We're going to do it totally different. I'm going to have you keep these aligners on during the month or two that it may take us to jump this thing. And so when we try to go through there, we're going to protect the teeth with the Invisaligner, and we're not going to let you try to shove the lower front ones back out and fold the upper front ones in and crack off pieces of enamel off the edges and everything else while you're trying to eat. We're going to keep you in the aligners. It's going to be a lot more comfortable, and you're going to eat bananas and Jell-O and whatnot for however long it takes. And that was it. It was like, can I get him to do this? I think when he heard that was what was going to have to happen, and he went through the experience that he did before, he knew that this was going to be the way to do it. Now, Invisalign, I just wanted to say a little something about Invisalign as far as bringing it into the cosmetic dental practice, because this has been super fantastic for us. One, all those people that came to the cosmetic practice that didn't want to wear braces, a lot of them came so that I could drill their teeth down and put veneers on them. And then I had this body of patients that I couldn't do that without doing endos or extractions on. And then it was like, I got to wrestle with the ethics of this, you know. How can I do this without, destroying these teeth to make them look good? And it's all just for cosmetics. It was tough. But Invisalign came along, and allowed us to do this art form without having to do that to the teeth and really make something available for the cosmetic dental patient. So with that, it was a super cool thing. And then that opened a whole new vista of looking at things and trying things that nobody else was willing to. And, well, I sure like that, say yes. We need to do that. This Invisalign is capable of doing all kinds of things and take a little bit of risk, tell the patient we are, this is a brand new thing, and let's give it a go. And that's how these cases came about. I'm sure a lot of us that have gotten to present now or are looking at, wow, you know, look at the amazing things that Invisalign can do. This case right here would have been incredibly difficult with straight wire. For those of you that have done this, this is a tricky case. You got bare teeth in there the whole time, but putting brackets and wires across those front four with those lower incisors right there, he wouldn't even be able to eat day one. You put those on and start shearing those off, and you'd just be wrestling with all kinds of stuff, build up huge blocks in the back so they can't bite on them, and it could have been pretty wild. But anyway, that's my case.
Thank you, Dr. Moore. Amazing crossbite jump there. You described the process of the bite jump quite in detail, but about how long was that patient experience to jump the crossbite?
That was, I said 1 to 2 months. I think it was probably more like 2 to 3 months of where the collision was really bad. The aligners were protecting this guy and helping him a lot. And one of the things, too, that was cool about that was that while he was in the aligners and hitting on top of the aligners, it was seating the aligners just so much better that when I got to the end, all the teeth were fully expressed in their alignment. And with them expressed in the alignment, I get there and I go, man, you know, I don't think we need a refinement for this.
Right.
So it's a one-phase treatment.
Right.
Yeah.
Great risk.
Thank you.
Reward.